This is Dr. Chappuis from Spine Center Atlanta, and we're here today to talk to you about what you should do as a patient if you happen to be in a motor vehicle accident, a car wreck, injured in some way. Now, if you're in a motor vehicle accident, you need to make sure the police are called. You don't move until they come. If you're in pain, you want an ambulance to come and take you to an emergency room to be evaluated. The other key point is you need to make sure you contact your insurance company to let them know what happened. Once you're done with a police report, you leave and you're still in pain, your other option then is to go to an urgent care and be evaluated. Most insurers require you be seen within 72 hours, which I think is very reasonable, at least to be evaluated, a diagnosis made, and then appropriate treatment recommended. Now, who should you see? Initially, the visit, I think, should be with someone, either a medical doctor, orthopedic surgeon, neurosurgeon, someone who can evaluate you, see whether or not there's any other injuries that need to be looked at. Most likely they're going to consider an MRI scan and then recommend conservative care. Chiropractors are also excellent people, providers to see after accidents, and you may end up seeing them first, which is fine. But I think somewhere along the lines you should see an orthopedic surgeon or their practice to evaluate you along with your chiropractor. And many times we work together as teams with them. They're good providers, and I think this gives you an opportunity to benefit from both their expertise and ours. What are the more common injuries from a motor vehicle accident? As it relates to the spine, you can have disc herniations, fractures. This could be in the neck or back area. If you hit your head, you can have a traumatic brain injury. If you hit your shoulders or your knees, you can have injuries there, such as rotator cuff tears in your shoulders, meniscal or cartilage tears in your knee, anterior cruciate ligament tears in your knees. If you're holding the steering wheel, you can have injuries to your wrists, including carpal tunnel type injuries. All these things will get sorted out for you by a physician as you see them and working with your chiropractor. The next question is, how long should you be treated? Be treated long enough to where your pain is resolved or your pain improves. Now, we always like to treat patients conservatively with chiropractic care, physical therapy, injections. If none of those work, you could be a candidate for surgery, but you certainly don't want to do that initially. You want to make sure you've had conservative care before considering an operation. And we can get into that in another video as to what type of operations, if you need one, would be best for your problem. Today, we're really just wanting to focus on what you should do in the immediate setting if you're in a motor vehicle accident.